So good morning, everyone. My name is Justin Garut. I use they or he pronouns. I have the privilege of working as the Health Equity Director at the New Mexico Department of Health. A little background, I was born and raised in a tiny little town in southern Colorado, but that's basically New Mexico. I'm from Antonito. Does anyone know where Antonito is? Mm-hmm. Yeah, or Antonido, depending on who you're talking to. It's that tiny town. A lot of folks went and got their pot up there before it was legalized here in New Mexico, right across the border. I was raised there to a Mexican Latino mom. The Jaramillos and Chulitas there are my family. And my dad's white, French American, hence the last name Garut. I don't know what it means, but maybe one of you do who actually speak French. Robert is going to speak a little bit during this presentation. Marshall, if you want to chime in whenever, please feel free to. I have been working on this for about the past 6 months when I joined the Department of Health. Before that, I was with the Environment Department. And it's been an honor to work on this project. I don't take it for granted that we have a governor and executive agencies that are on board to explore these issues and how to better support our queer communities. Robert, do you want to say anything? So, this is what we're going to go through today. The introductions. Robert's going to share a little bit of the history of how we've gotten to this place. I'll mention why collecting sexual orientation and gender identity, what we refer to as SOGI data, matters, as well as the role of the Department of Health here in New Mexico in this effort. EOH, as I'll refer to it from now on out, talk about some exciting updates that are in progress, and then get your feedback and questions and kind of talk about next steps. Please do feel free to ask questions during the presentation too. Okay, just raise your hand, and if there are online folks, just feel free to chime in. So we have about 85,000 of us queer folks here in New Mexico, 13 and up. It's us, it's our families, our friends, our colleagues, we're everywhere. Believe it or not a secret. I don't like how I framed this here on this slide, but we face a lot of barriers to health and to being able to be as healthy as possible. Whether that's whether that's getting access to services through the state or at the local level, at the national level. There's stigma, it's a real thing. I've was part of the MPOX or monkeypox, don't like that word, but the MPOX response here in New Mexico. And the whole time we're really trying to figure out how do we get the message out to the broader community that this is a thing, probably don't need to be worried about it, but also tailor our messaging to the queer community and let them know that this is a real thing. And there was a lot of conversations within the Department of Health of how we were going to do that in a way that reduced stigma. We weren't all on the same page, but at least we're having discussions and we did move forward. And I am proud to say that epidemiological curve, epi folks here, if you look at the national curve for MPOX, it's beautiful. It went all up and then came back down, and it does deserve a round of applause, yes, for our gay, bi, and heterosexual friend and other folks who were largely impacted. We got vaccinated, we changed behavior to some extent, and it shows. I'm really proud. I'm very proud of the work that we've done on that. Coming back to this though, this stuff's real. I'm sure all of us have our own personal experiences of being at the doctor, and so if they ask you like, oh, how many sexual partners do you have? And then like wide eyes, like what? Like, or you really have that many partners or something like that, right? We're not operating in a queer society necessarily. However, this is exciting. I was born in 1990. I stand on the shoulders of giants and a lot of people who have come before me and gotten us to the place where we are now, right? We're more visible than ever. We still, though, don't have a lot of data when it comes to across the board, whether we're talking about environmental issues or transportation issues. It's not a given that sexual orientation, gender identity data is included in these data sets. And without these data, I can't make a case to a cabinet secretary or to a governor that there are inequities here, that there are barriers here, that our communities aren't getting what they deserve and need. And this is where this whole effort comes into play.
Okay, cool. So I talked a little bit about some of this earlier. I'm not going to repeat all of it, but I think what's been really exciting to me in this process has been the willingness and even excitement of folks at the state to have input and partnership with the community. Not only was it our push and Marshall's push in particular that helped us get to the point of the executive order happening, and after already two bills that made it both times through the Senate completely and through the House, except for the very last vote, right? And the only reason they didn't pass both times had nothing to do with real pushback from the legislature. It was more about what was going on the House floor at the end of session, and did they want to even approve anything at the end of session, right? So I think it's really exciting that we live in a state where we all often talk about what we don't have, and we certainly, don't have all the resources we'd like. But I think it's really exciting that partnerships of this kind are really possible here in a way that they're often not in other places. The governor's office listens. The Department of Health listens. So not only have we been working with them for years on the collection of SOGI data in the two big health surveys that DOH does, and working with different programs along the way who recognize that because of the populations they were serving, it was really important that they do a better job of collecting SOGI data and knowing how queer folks were moving through their programs. But through this whole process, working with Justin and other folks at DOH, including the EPI folks, even on questions like what questions are we going to ask? What are these questions going to look like? What are the options we're going to give folks to answer? Kind of thing that state health departments tend to like to impose rather than talk about. I thought it was really exciting that we actually had really good dialogue. And they always seemed to listen. They seemed to be responsive. Didn't always do what I would do, but who's to say I was right anyway, right? So that's not the point. But it was a really meaningful interaction around how do we do this in a way that's scientifically appropriate, right? The last thing I really want to say is our goals were the same. We want to get good data, right? We don't want bad data or ask a bunch of questions that no one answers or doesn't answer accurately, right? So we want good data, and we want to avoid pushback against the queer community, right? So we don't want anyone who's not part of our community, when they start seeing these questions, to say, oh, it's a queer state. What are they doing? Why are they making this all about queer people, right? And we had really, really, really good support. Having Justin move into the position when he did was certainly fortuitous, and we're grateful. But it's not just Justin; it's also lots of other folks, all the way up to the secretary's race. So I just want to acknowledge that, and then I'm going to let Justin talk more about it. Thanks, Justin.
Sweet, thank you. I guess I should talk about the last point here, which is the executive order. So I made a big assumption jumping into this without even contextualizing it. But this executive order came out a little over a year ago, August 2021. An executive order is something that the governor can put out and direct any executive agencies to do, right? So it's within a governor's authority to do that. It's different from legislation, which the legislators work on and put into law. So it's important to remember that this is an executive order, but the election this past week was so important too, because with the new administration, this executive order could have and would likely have been effectively slashed, right? And I would still have been, I'm glad I can talk in hypotheticals about this now. It was a nervous week. We would still have had progress. And I do believe we could still have kept going during a different administration to make progress on this as well. So this executive order basically asked all executive agencies, so think Department of Health, Human Services Department, Children, Youth and Families, Department of Military Affairs, Homeland Security, Tourism, Public Education Department, all those departments. The governor asked all of them to look and see where you can add, you being the departments can add SOGI data into it and to do it. However, the executive order didn't clearly list any agency as the lead. if you don't have a leader, it's hard to make progress, right? So at DOH, I'm trying to be like a coach to other agencies and speak with them and be like, hey, this is the thing. Did you know it? What are y'all doing? They don't have to answer to me, just to the governor, right? But that's some context for what this executive order asks for. And the whole goal is to reduce barriers to accessing state services for LGBTQ folks. So at DOH, this is what I'm trying to do. I'm trying to support 30-some executive agencies with their questions, with strategy, trying to figure out where it makes sense and where it doesn't make sense to include this data, right? We don't necessarily just want to put SOGI data everywhere just for fun. We want to use the data that we ask. It's been essential to have Marshall and Robert and other community partners involved in this process because I am a member of the community, but I also don't know everything because he does. So it's been nice to have a team to kind of strategize and work through things to come up with even better products. Training is something that's important, right? You have an executive order. If you implement these questions in one of your data sets, if you're a state employee and you're asking these questions, but you've never had any training on it and you're nervous about them yourselves and you don't really know what gay means or whatnot, like how is it going to be effective and how is the person on the other side, one of our community members, going to feel about it? So we've developed, and we are in the process of finishing training modules for state employees internally to take so they understand what the executive order means and what SOGI is, why it matters, why we're even doing this, as well as how to navigate pushback from folks who are asked these questions, who might take offense to them, or who might not trust what is going to be done with the data themselves. We've developed suggested questions on SOGI as well. Our epidemiology team within DOH really helped develop questions. One of my colleagues, Annalise, is here. There's a great team of folks that have looked at the national best practice questions. There's no perfect questions. I don't know that there ever will be because our terminology changes quite a bit, but we've provided agencies with questions in English and Spanish. We're also hoping to support post-implementation. So once these agencies start asking these questions, trying to figure out how we're actually going to use the data to improve services. And then there's an evaluation component that we've been exploring with Katie at Fire and Robert and others to figure out how we can make sure we're going to learn from what we're doing. We don't have a lot of capacity within the Department of Health in terms of evaluation. From my perspective, we'll have a 25% vacancy rate, so we're down 1,000 folks. Not easy to keep doing the work, but that's why we need folks like Katie and other scientists to help us out. So here's some updates. Pride Month, this last Pride Month, we pushed out our recommended questions to all of the state agencies. So here are the questions, have at it. If you want to change any of the questions, let us know. We'll work through them. I've had tons of meetings along with our community partners with military affairs, the environment department. I was so scared to go to military affairs. I'll just put that much out there. I don't think I've passed the National Guard place there on I-25 by Santa Fe so many times, and I'm like scared. It just doesn't seem like a welcoming place, right? But I had such good conversations with folks in military affairs, and at Homeland Security, we talked about some of the emergency management stuff that happened this summer with the fires and slip-ups that happened too, supporting queer folks in Las Vegas and in other areas through some of the shelters that were set up, right? And so what I want to say here is that even if an agency ultimately decides not to ask some of these questions or include them, I think the fact that we're having these conversations and intentionally thinking about ways to better support queer folks, I think that really matters. I don't know how to measure that, Katie, but I think the fact that these conversations are happening at these levels in every state agency, thanks to this executive order and all the advocacy work, I think is really important. And to take that one step further, in some of the locations, some of the departments, they've been like, well, at environment, for example, we regulate a lot of businesses. Do we ask if a business is queer? Does that make sense or not? Maybe we need to focus more internally on pronoun usage or LGBTQ trainings or transcultural fluency trainings from the Transgender Resource Center. We've done some of those. And I think that those internal efforts are helpful too, although not necessarily the purpose of the EO. It's kind of a unintended nice consequence. This last one Robert mentioned as well. We had multiple meetings with the Department of Information Technology, so they do all the IT systems for the state, as well as with SPO, the State Personnel Office. And we've worked with them to build out a module for the HR system so that, you know, if you get a new job, they usually ask you what your race is, what your ethnicity is, what your veteran status is, your disability status. And if you want to, you can give that information. So alongside those questions that the state asks, we will now have all state employees able to answer sexual orientation, gender identity, pronouns, yes, and pronouns. And most of that will be private. The only piece that will be public in the sense of like open for other state employees to see is the pronoun piece, because that's important, right? And we want, that's like an external type thing. So this is huge. It's supposed to happen before the end of the year. If it does, I will be so happy. It's almost too good to be true in terms of this being one of our early bright spots to celebrate, but it's huge because it's going to impact every single state employee in New Mexico. I don't know how many state employees there are, but there's a lot. I don't know. Largest employer in the state. It's cool. Here's some more things. We're working on this training module that'll be on demand for all employees at the state to take if they want to. Some departments have said they're going to make this mandatory. Other departments are taking the voluntary approach there. And then we want to also offer tailored trainings for individual departments because, you know, MVD is going to, motor vehicle division is going to be asking different questions, or none, who knows, than environment or then Department of Health. So I've been working with Robert a lot and Marshall on some of these trainings that we're hoping to give live, either in person or virtually, for specific departments to talk about the implementation efforts there, so that those employees are prepared to ask these questions. Communications, we've talked about some external communications pieces so that the career communities feel comfortable, our career communities feel comfortable answering these questions and have a heads up that this is happening. And the last piece is evaluation that I mentioned, exploring some options for national funding as well. Yeah, so I'm open for questions. I'd also love your feedback or concerns or anything. Like, what do you think about this? Is this useful? Yeah, please. Mike, yes, thank you.
Thank you. I don't know if you remember, I was here last year and spoke against this idea. Let me introduce myself. I'm Stephanie Viranova. No, that's not my legal name. You're wondering why, reasonably so, you should even listen to me. I work for a state agency. We grant licenses. For the last couple of years, I have been the head of the licensing division. We have many applications, and all of them have a place where you sign your name. And there is a statement where you sign your name. And it says, I, put your name down, under penalty of perjury, state that all of the foregoing information is true and correct to the best of my knowledge and belief. That makes it in the form of an affidavit. The important part is under penalty of perjury. If you put incorrect information on that application, the least that can happen is you lose your license and your job, your livelihood, who knows what else. But perjury is a felony. And we don't, but we could prosecute you. And perjury, I'm not sure what the penalties are, but a fine, prison time, but you are a convicted felon. Putting this information and requiring people to disclose, I'm sorry, I'm getting really nervous. I'm usually not like this. Sit down, or you fall down. Sorry about that. If you put this information down, we keep stuff for 10 years, that's statutory. After 10 years, if you're inactive, we can purge the record. And it goes to state archives where it exists forever. This information that you're asking, you're telling people under penalty of perjury, disclose your sexual orientation, disclose your gender identity. Now, that might be fine. Now, a few years ago, that information would have been acceptable to people like, oh, I don't know, Jeff Sessions, Bill Barr, Donald Trump. Do we really want to create a database of who we are? If you want to know the real problem with that, there was a small clinic, small but really cutting edge. They did a lot with HRT, SRS. They were well known worldwide. This was back in the 20s and 30s under the Weimar Republic. Within months of the Nazis coming to power, they showed up and kicked down the doors, and they dragged the staff out to waiting vans. They were taken to a small town northwest of Berlin, where they were put to work building barracks and fences and creating a camp that later was named Dachau, the first concentration camp. Meanwhile, back at the clinic, all of the records were dragged out into the courtyard and burned. All of the equipment, all of that knowledge and research was lost. But the one record that they didn't burn was the record of all of the patients. Those were turned over to the Gestapo. And the Gestapo used that information to track them down and put them into the concentration camp too. No, we're not Nazi Germany. We came pretty close a few years ago. I'm sorry, but creating a database of who we are, to me, is a very, very, very bad idea. In the realm of bad ideas, this is the type
I told Justin I would take this. I appreciate Someone Marshall Martinez, the Executive Director of Equality in Mexico. I appreciate all of your comments. And I think that those are valid fears. And I think there are a couple of things that should be made really clear from the beginning of this process, right? Number one, the collection of this data is always optional. As with literally every form you fill out in the state of New Mexico, other than the legally required information for your driver's license or your voter registration file, all of your demographic data is optional. Folks hopefully have gotten a flu shot so far this season. When you go to get your flu shot, they ask you, how old are you? What is your sex? Maybe they ask gender. I don't remember what they do on the form. They ask you your sex or your gender. They ask you your race. They ask you how much money you make. You don't have to fill out that form. These questions would be added to that form. It would not be printed on your driver's license. And in all of those agencies that Justin's talking about that we've had these conversations with, we are clear, we are not keeping a database, right? So Robert comes and interacts with the higher education department. I'm trying to think of what, So Robert comes and interacts with the higher education department. He comes because I don't know what they do at higher ed, so he's filling out a form because he wants to be involved with higher ed. He has a whole list of demographic questions that he fills out, and all of those questions get separated from his name. So the only information that the higher education department has is Robert's name and, I don't know, the license number for his certificate to teach in higher ed or whatever. All the rest of that information gets removed from his record. It's anonymized and added to a giant list without identifying characteristics, right? So the first thing is that the questions are optional. The second thing is that they are completely anonymized from your record in any way, shape, or form. So there will never be a list of queer or trans folks in New Mexico, right? Third is that New Mexico, both at the legislative level and in the regulatory level, has some of the strongest privacy protections in the country for the sharing of data. For example, one state agency in New Mexico
cannot compel another state agency to share their data without a court order. If Justin at Department of Health wants to go to motor vehicle department and ask them for a list of every registered driver, he has to do what anybody else would have to do, which is file a lawsuit in a state district court and ask a district court judge to compel the motor vehicle department to give him all of those records. And extraterritorial requests for data. So anybody outside of the state of New Mexico has to be granted access to that data from a federal district court judge. So Jeff Sessions, thankfully isn't around anymore, right? Folks at the federal administration, even the federal Department of Justice has to go to court to get access to the list of people that are kept by a state agency. So while I think all of your concerns are absolutely valid, and we know this is why Justin talked about the communication mechanisms, right? EQ&M, Robert, DOH, and others are going to be doing a big public education campaign to let folks know you don't have to answer the questions. And if you do, this is what will happen with your data. But we have multiple layers of protection to make sure that anybody who wants to answer these questions but doesn't want other people to know that they are queer or trans folks, that is absolutely what will happen. Unless the entire judicial system falls apart and everybody just gets access to that information. And when we hit that point, I think we have a lot of things to worry about. And this is not good. I'm not saying it's not important. I'm saying it's going to be one of 50 things we have to worry about. And literally everybody in our communities is going to be in danger. So I hope that helps folks to understand all of the various safeguards. And we thought really long and hard about this executive order when we were drafting it with the governor's office to make sure. And as we've drafted the legislation, it has all of those same redundant protections written into the legislation so that if it passes, all those protections will still exist.
Thank you. Thanks so much for bringing that up. Any other questions, comments, concerns? Yeah. You will pass back as the talking stick.
Just first, thanks for all the work you're doing for that optional voluntary and for the comment to make sure that there's safeguards and protecting people, because there are a lot of unknowns in our world, as we're reminded of all too often maybe. I just also want to say as a positive, hopefully input that, you know, they're thinking about, you know, asking people about, or healthcare providers about sexual activity or sexual identity and so forth is sometimes challenging, but I also just want to remind ourselves that there's all kinds of sexual expression and all kinds of sexualities, and especially nowadays with Tinder, I'll just say, you know, as well with, I want us to remember too that I try as a healthcare provider to not assume what anyone's sexual behavior is based on their identity or gender identity, all because that they, I think, have no correlation necessarily, and that all human beings have a range of sexual expression potential, including asexuality, even being gay or bisexual or whatever. So I just wanted to share that comment about, you know, when we ask people about their sexual behavior, it's usually to help people to be safe and well and not judge, hopefully. And I know that's not always the case for all healthcare providers, but I also don't think that healthcare providers should assume what people's behavior is or not based on that. And that's what we're trained as, you know, disease prevention specialists, sexual, you know, HIV test counselors and prevention specialists and so forth. So just want to share that.
Justin, can I add something? Yeah, just one thing I wanted to add, again, thank you for all your comments. These are things we have been talking to the state about. We're not on different, you know, whatever perspective here. We just we think it's really essential that we pay attention to all data and how they're cared for. The things came up that I think are really interesting to think about on the other side too. They don't change any of that, but like we had a really interesting conversation with cultural affairs, and they were thinking not just what do they have to do, but how could they use this as an opportunity to learn things they don't know. And one of the things was to add some questions about demographics to optional response forms that folks complete when they leave a museum or a cultural site, where people could identify as a person of color or a queer person or a trans person if they want to, particularly if that's related to their comment. So this could potentially help us to find that there's a person or a site where it's really not a good thing to go if you're a queer family, right? Because you're not going to get treated well. And we want folks to be able to do that so that we can learn and respond to that, and they want to learn that too. So I think it's this huge balancing act that we have to be really careful about safety and privacy, but we also know that data are power. And so it's like, how do we do both? And how do we take care of everybody? And part of it is making it always off. Let's take one more question and then take a break. Well, since I'm talking already, let me say when we take the break, we'll take 15 minutes. We'll come back at about 5 of, and there are snacks out if you need them, bathrooms in this direction down the hall. Thank you.
So particularly, I'm wondering what, I guess I have a few questions. What sort of capacity have you been working with more like municipal-based organizations? For example, like APS for here in Albuquerque. I'm wondering what sort of trainings can be done to help our sort of data collection. As well, we're currently running into an issue where we're wrestling with parents having the ability to pull a student's like records for counseling, as well as superimpose their own parents' perspective of their child's gender identity onto the school records. And I'm wondering what, like, is there some sort of like line of cooperation we can have with the DOH to help like create a system where students can live authentically, or at the very least give APS the information of their authentic selves without having parental involvement? Like, is there state statutes we have to worry about? What is the process that we can do to help protect these students?
Thanks for that question. I think the local level is super important. It's important to remember, though, that this entire effort in the executive order is only geared at state executive agencies. So there is, though, the Public Education Department, PED, right, who we're in conversations with about how to integrate some of this data into their current surveys as well. So that's the angle I could see getting at the local level of schools and school boards. You'll talk about it in your presentation. Okay, Marshall's going to share some more on this, but I agree there's work to be done as well at the local level. And I hope to be able to explore ways through the state agencies that oversee them, oversee to some extent, right? We have a lot of local control when it comes to schooling, but it seems like there could be ways to have those conversations to support what you're talking about. Thank you. Thanks, everyone.